Statistics on PTSD, MST, anxiety, and depression are relatively easy to find. Less known are stats on eating disorders. This is a little discussed topic, though the connection between PTSD and eating disorders is high and is a risk factor for suicidal ideation and attempts. Eating disorders in the military affect 63% of enlisted women and nearly 7% of men. Women veterans who experience military sexual trauma or MST have higher risk for post-deployment eating disorders, and overall, women veterans are 6 to 10 times more likely to develop bulimia than civilian women. Men are also affected, and the stigma of eating disorders in both men and women creates many silent sufferers. There are two main eating disorders: bulimia, where purposeful vomiting or purging is done for emotional relief or for control, and anorexia, with reluctance to eat and gain weight, or becoming severely underweight, also for control. Eating disorders' connection with the military is related to the intense physical demands, life-altering experiences, and like elite athletes, a focus on athletic performance under extreme stress. For some struggling with PTSD and the symptoms such as insomnia, flashbacks, depression, anxiety, and hypervigilance leads them to seek external factors to control. In this case, that's food intake, calories, taking excessive exercise, and lowering the weight. This is a complex problem, and integrated physical and psychological care is essential for finding recovery and healing. In a world where little seems in their control, eating disorders for those susceptible can be seductive and increasingly entrenched. If you are or know someone with an eating disorder, finding a practitioner who understands the complexity of PTSD and connection to eating disorders is essential. Persist at the VA, and also research the many private organizations who specialize in holistic care, using stress reduction, talk therapy, physical care, and consistent, effective treatment tailored to the individual. Untreated, eating disorders can lead to entrenched patterns of self-abuse, debilitating physical effects from destructive weight loss, and effects of routine vomiting, isolation, depression, and other psychiatric disorders. There is greater knowledge today about military service, eating disorders, and treatment. Please support those you know suffering and research all treatment options. Recovery and condition management is very possible.